The FDA has approved the sale of Narcan without a prescription. Narcan is the brand name for a drug that can reverse opioid overdoses. By late summer, it will become the first opioid treatment drug to be sold over the counter. The FDA's approval will also make it available in stores that don't even have pharmacies. For more on this development and how Narcan can be used to save lives, Dr. Julie Nowinski-Konchak, who is an advisor for the Substance Use Disorder Program at Cook County Health. Thank you for being here. This has been something that is so critical. Overdose deaths are at a crisis level. This drug really changed outcomes, but was it used enough?
Thank you for having me here tonight. Yes, you are right. We are at in an overdose crisis indeed. That's not getting any better. Locally here in Cook County, the medical examiner expects via provisional data that the 22 numbers are going to exceed 2021. Today was a good day for overdose prevention. Um, Anything that can be done to make naloxone, an overdose prevention reversal medication, and more available is a great thing. Having it not require a prescription and be over the counter and just accessible down the aisle as you're doing your grocery shopping, it will be very positive if it increases access. I have some concerns about the cost, so that will be to be determined, as well as right now insurance covers Narcan and naloxone quite well for many of my patients, and if that goes away because of this change, that will be not doing any favors for the public.
Right, and it's also a matter of educating people, isn't it? Because if you don't have this readily on hand, it's not as if someone who is having an overdose can go to the store to buy it over the counter. You need it in your possession.
That's right. That's right. So you bring up a great point that it's going to take a lot of planning and foresight and thinking about wanting to be ready in the moment and purchasing it over the counter if it's not cost prohibitive. And that will be great if it increases access for some. And you raise the point that we need other levers to bring naloxone readily, make it readily available. So some jurisdictions have vending machines where it's free and you can go get it in public spaces. I went and brought my kids to the library the other weekend, and it was right there by the door. In clinic yesterday, we dispensed naloxone directly to patients. All of this is free, and that's really important. We have to continue the programs in place to get naloxone in the hands of those who are most likely going to be positioned to do an overdose, and at the same time make it more accessible to all. And remembering that naloxone is one a really important tool in the toolbox, but can't be our only tool in the toolbox when we think about overdose prevention.
Right, and that's the case because this is not going to happen overnight. We've got the formulation needs to change, the manufacturers of the over-the-counter version. That needs to ramp up.
So there is going to be a time delay before all of this happens, and you're right, we're experiencing the overdose crisis now. So continuing, we're fortunate to be in a state that is funding free naloxone and putting it in the hands of community-based organizations and health centers to then get it out to the community via street outreach, via um, social service organizations, via health centers. And there's really important overdose prevention tools like overdose prevention sites, access to methadone and buprenorphine for treatment that are protective against overdose, drug defelonization, all sorts of other societal policy systems and environmental change to help us get ahead of this crisis.
Yeah, and it's so important. We're not just talking about adults and people who are using, but oftentimes children inadvertently end up ingesting it. Doctor, thank you so much for joining us. It's an important development today.
Thank you.